Does your loved one suffer from a chronic fungal rash, particularly of the trunk? This can be very difficult to treat, but I'm here to help you. I'm Alan Bienstock, and I'm a board-certified plastic and reconstructive surgeon. I specialize in wound care, particularly for those that are homebound and bedbound. I'm here to help you regarding your loved one's wounds, as well as talk about chronic fungal rash. So we had talked about in a previous session about fungal rashes in the acute setting. These are easy to manage with powders and other creams. When you have a chronic fungal rash, meaning it's been around for 6 months to a year, it becomes much more challenging to get better. The skin looks very raw and irritated. It has a purplish reddish hue, and this can be very difficult to treat. That doesn't mean it's impossible. So things that I've discovered is, number one, as we talked about in the previous session, we want to leave the diaper, if the loved one's wearing a diaper, or some sort of brief open tear, as much as possible. We want to eliminate moisture as much as possible. In my experience, the fungal powders don't work as well, even though they're great in the acute setting. In the chronic setting, they're not as good. What I usually do is I kind of create my own cocktail. I mix a fungal cream such as nystatin with zinc. I put a little over-the-counter hydrocortisone cream, and I put sometimes a little aloe vera to be soothing. I'm going to do this probably twice a day. This will take weeks, if not months, to get better, but this can be very soothing. But we also have to make sure we're eliminating any fecal contamination, urinary contamination. If this doesn't work, we can come up with other cocktails, but this has been my number one go-to. The redness and purple irritation takes a long time to go away. I had a patient I saw today who's had a fungal rash for 2 years, and we tried this combination. After 3 weeks, it got much better. So this is something that be as challenging to treat, not impossible. We need to really be on top of things. I would have to be very creative. I normally never use hydrocortisone or steroid creams. This is the one time that I do recommend it because it's chronic inflammation. And inflammation, when you have chronic inflammation, it becomes more challenging. That's why I would use a steroid cream. You don't want to use it for too long. I usually use it for 2 weeks, and I take the steroid cream out of this cocktail. If you have any questions or comments, please leave them below. Make sure you subscribe to our channel, and I look forward to our next session. Thank you.